Hello guys, welcome back, and today we are going to discuss about nursing diagnosis and care plan for impaired urinary elimination. So what is impaired urinary elimination? That we will see first. Impaired urinary elimination is defined as patients' difficulty in eliminating urine or their inability to completely empty their bladder. This condition may be caused by a variety of factors like incomplete bladder emptying, systemic cause, and mental or physical disability. Now we will see the nursing diagnosis. Impaired urinary elimination related to urinary tract infection as evidenced by dysuria, urgency, and cloudy urine. And what is the goal? The patient will start or demonstrate effective urinary elimination within 48 hours. So while writing the nursing diagnosis, you have to add these three components for sure. Okay, compulsory you have to add problem related to cause as evidenced by signs. So problem is impaired urinary elimination. Etiology is UTI. Okay, and the symptom is dysuria. Now we will see the care plan. So while writing care plan, you have to follow these columns, right? Assessment, diagnosis, planning, rational, implementation, and evaluation. In assessment column, always write subjective data and objective data. Okay. So what is the subjective data? The patient situations. Okay. What patients says about their condition. That is subjective data. So patient reports experiencing an urgent need to urinate, pain, and has noticed that their urine has become darker in color. So what that is the patient observation. Objective data means what you have observed from the patient situation. So this is your observation. The patient appears fatigued and frequently going to the bathroom. Additionally, their urine has become cloudy and has strong odor. And what is the diagnosis? The same diagnosis and the same goal you can copy and paste here. Impaired urinary elimination related to urinary tract infection as evidenced by dysuria and cloudy urine. What is the goal? The patient will start demonstrate effective urinary elimination within 48 hours and absence of dysuria, decreased frequency, and clear urine. Next column is planning. Always start your planning with history collection, physical examination. So what is that? Do history collection and physical examination. Next column is rational. Always start your rational with two. Okay, to understand the present condition of the patient. And implementation, you can write in past tense. Done history collection and you can record what you have done. Okay. Then next planning, assess and document the patient's voiding pattern, including frequency, amount, color, and smell of urine. What is the rationale? To understand the elimination pattern and problem. What is implementation? Assessed and documented the details. Next planning. Encourage the patient to drink 8 to 10 glasses of water per day unless contraindicated. Sometimes some patients cannot drink. Okay. Then what is the rationale? To maintain adequate hydration and reduces the risk of urinary tract infection. What is implementation? Encourage the patient to take or drink 8 to 10 glasses of water per day and started doing it, and also observe for contraindication. Next, planning. Assess with voiding technique. Sometimes, when we support, the micturition reflex will get stimulated. So, what is the rationale? To stimulate the micturition reflex and promote complete bladder emptying. What is implementation? Suggested techniques, and you can mention the techniques like double voiding. What is double voiding? Urinating, resting few minutes, and trying to urinate again. Or also on the tap automatically while listening that running water sound. No, sometimes the micturition reflex will get stimulated, and also provide some privacy. Next, planning. Administer medication as prescribed for what? To treat underlying cause like infection. What is the implementation? Administered medication such as antibiotics, antispasmodic, that is depend upon the situation of the patient. What is the next planning? Educate some lifestyle habits for what? To reduce the symptoms and improve urinary elimination over time. What is the implementation? Educated to avoid bladder irritants like caffeine, alcohol, spicy foods, and also perform Kegel exercise that will stimulate this elimination. Then in another video, we'll discuss detailing what is Kegel exercise. Okay. Then what is planning? Next planning. Collaborate with other healthcare providers. Okay. I mean like consult with other healthcare providers. What is the rationale? To ensure that the patient receive comprehensive management based on the needs of that patient. Consulted or collaborated with urologist, physiotherapist, or dietitian. Not neurologist, okay? Urologist, okay? Physiotherapist or dietitian as needed. Next, planning, assess the overall health status of the patient. That's very, very important. You have to assess the overall health status of the patient. For what? To reduce the symptoms and also find out the solutions. Implementation, assessed the patient's urinary elimination pattern again and evaluated the patient's comfort level and ability to void without difficulty. So these are all the plannings you can write for impaired urinary elimination. Okay. And what is the evaluation? The patient started or demonstrated effective urinary elimination within 48 hours with an absence of pain, dysuria, decreased frequency, and clear urine. Okay. If it is started or demonstrated within 48 hours, you can write within 48 hours. Otherwise, you no need of writing that 48 hours. Okay. You can write the patient started, demonstrated effective urinary elimination and absence of pain, dysuria, decreased frequency, and clear urine. So this is the nursing diagnosis and care plan for impaired urinary elimination. Hope you understand, guys. And next time, another nursing diagnosis and care plan. And also we'll discuss these Kegel exercises also. Thank you, guys. See you.